February is American Heart Month, so during this time, it is important to better understand, prevent, and treat heart disease. Heart disease, the leading cause of death across our country, and the CDC says heart disease refers to several types of heart conditions.
So joining us in today's Leading SA segment is Dr. Dawn Way, cardiac surgeon at UT Health San Antonio. Dr. Way, thank you so much for making time for us this morning.
Thank you for having me.
First and foremost, what is heart disease and who does it affect?
Well, as you said, the first thing to know about heart disease is that it is the leading cause of death in the United States, and that's true for both men and women. Heart disease is a general term for any condition that affects the function or the structure of the heart, and most people are familiar with the most common type of heart disease, coronary heart disease, which is what causes heart attacks. People who are more prone to have heart disease are those who have diabetes, high blood pressure, who have used tobacco, or who have a strong family history of heart disease. But we know that heart disease can affect people that don't have any of those risk factors.
So, Dr. Way, as a physician, what effects have you seen on people's heart health during the pandemic when it comes to lifestyle choices and staying active?
That's a very timely question. What we've seen in the last 2 years is that pandemic-related changes in lifestyle have caused many of us to become more sedentary, myself included. Activities like meetings, classes, interviews like this that used to be in person are now online. So people are sitting still for much longer and being less active. And because of social distancing, our hobbies have shifted from more active social events to sedentary activities like watching television or having virtual get-togethers. We know that 80% of cardiovascular deaths are preventable with changes in lifestyle, and physical activity is one of the most powerful ways that we can do that.
All right, so speaking of physical activity, what are some recommendations for people trying to get back on track before it's too late?
Yes, not only is physical activity important for heart health, it has really strong positive effects for mental health, which is so important during this pandemic. We recommend at least 30 minutes of moderate activity daily. And getting physical doesn't require a gym. There are many creative ways to use your environment, such as using the stairs in your building, walking in your neighborhood. San Antonio has a great system of parks and greenway trails. And with cold weather, indoors you can walk or run in place or do jumping jacks. If you have children or grandchildren, playing tag or dancing to music with them are great family activities. And it's a great way to help set those habits early for the little ones.
Okay, so what are some warning signs of heart disease and, what tests do we need to get done? For example, like what age should you start getting your cholesterol levels checked?
Good questions. Most people know the chest pain as a warning sign of a possible heart attack, but actually I think more common, especially in this region, are more subtle signs of heart disease. And these include feeling short of breath, either with activity or with laying down, feeling tired with daily activity, swelling in the legs or ankles, and sometimes heart disease can mimic other conditions like heartburn or asthma. So if you're being treated for those conditions but continue to have symptoms, it's important to have your doctor rule out heart disease. These days, through technology, we have more and more medical tests, and many of them are non-invasive. A stress test is a good way to pick up, but it's not always doesn't always detect heart disease. There are guidelines for having cholesterol checked. Usually at the age of 40 is when you begin screening. But again, if you have a very strong family history or certain risk factors, it may be important to get those checked earlier. And talking to your doctor is the best way to get answers to those questions.
I'm glad you brought up family history because, it can be in your family history. So anyone can get heart disease, right? It's not just someone who's overweight or, has been sedentary for a long time.
That's right. Unfortunately, there's been a lot of scientific breakthroughs and understanding of these things. But I tell my patients, you could do everything right. You could eat a healthy diet, be active, have no family history, never smoke. And for some reason, people that fit that profile still have heart disease.
So it's always important to continue to get those tests and checkups. Dr. Way, thank you so much.
Thank you for having me.